Hi. So today we're going to be talking about GI bleeding whenever you're called overnight. So first thing you need to think about is, where does the patient need to be? Can they stay where they are, or do they need to go to the ICU? So whenever I get that call from the nurse, the first thing I ask is, how does the patient look? Do they look fine, or are they very symptomatic? While I'm asking that, I also ask for them to get another set of vitals and ask some basic questions about the patient. Are they on an anticoagulant? Do they have a history of bleeding? Is there a reason why they would be more at risk to have a bleed? Or were they admitted to the hospital for a GI bleed and recently had a scope during this admission that didn't show much or showed something? While you're doing that, also pull up the patient's chart. Read your sign out. Give yourself a good idea of what's going on with the patient. All of that combined gives you about 2 to 3 minutes of time to just center yourself, get to know the patient, and then be prepared to go see the patient. So 3 different patient scenarios that for you to consider. All right, so your first patient, their blood pressure is 120/80. They are maintaining completely fine. They just had 1 episode of blood loss, and they have this history of chronic blood loss, got admitted to the hospital because of it, had a colonoscopy a couple days ago that was completely normal with no signs of bleeding. So for this patient, you really don't have to do very much. Just check on them, make sure they're still feeling fine. Repeat their CBC just to make sure it wasn't a huge drop in their hemoglobin after that episode. And just reassure them. Go ahead and make sure that you check on the patient later that night. Make sure that the nurse calls you if anything were to change. But they can stay on the floor. They don't need to go anywhere. So patient number 2, they're maintaining fine, but their blood pressure is now 90/50. They had that 1 episode of bleeding, but they have no history of blood loss, haven't had a recent scope, not really clear why they're bleeding. So for this patient, go ahead and again repeat the labs, but also give them some fluids. Bring that blood pressure up a little bit. They don't have to go to the ICU at the moment, but keep a close eye on them. We don't know why they're bleeding, since they don't have that history, don't have the recent colonoscopy or EGD. So just approach them with a little bit more caution because it's not quite as clear cut. And go ahead and make sure that they're not on any medicines that could be promoting the bleed. So stop any DVT prophylaxis like heparin, Lovenox, stop any blood thinners if they're on them, and just take a look to see if there's any other reason that you could see why they could be bleeding. They're getting a bunch of naproxen or a bunch of NSAIDs. Go ahead and stop that too. And I would go ahead and put this patient on a PPI as well if they aren't already on them. All right. So for patient number 3, this one is hypotensive. They're altered, they're pale, they just look really sick, and they have ongoing blood loss. So for this patient, regardless of if they have a history of blood loss, they recently had a scope, it doesn't matter. This patient needs to go to the ICU. And in order to do that, go ahead and call your MICU resident while you're in the room with the patient. Don't leave the patient. Hang fluids, draw labs, including a CBC, coags, type and cross. Go ahead and prepare some blood and bring up 2 units of RBCs just to have at bedside because they're probably going to continue bleeding and needing more blood. And go ahead and call the GI fellow. Discuss the patient thoroughly with the GI fellow, see if they need to come in that night, or if the GI fellow feels like they're comfortable enough just doing supportive care and then seeing them first thing in the morning. Either way, it could be an option, but as long as the patient gets the care that they need with the fluids, blood products if needed, and movement to the ICU, that should be okay. Another thing to remember too is to go ahead and change that patient to IV PPI. Even if they're on a PO pantoprazole, it doesn't matter. You need an IV. And then also look at their history. If they have any history of cirrhosis, go ahead and add ceftriaxone or another antibiotic for SVP coverage because these patients are at high risk of getting that if they're having a GI bleed. Also for cirrhotics, go ahead and put them on octreotide. That's for patients with esophageal varices, either known or if they are at risk from the cirrhosis. Other side point too is to make sure that they have 2 large bore IVs It doesn't matter if they have a central line or a PICC line, because you can give blood products a lot faster through the IVs. So they need to have both of those. So for this patient, the main thing to remember is be comfortable to call your MICU resident and your GI fellow, because they're the ones that need to see this patient, need to take over care for them. And with that, you should be able to handle your GI bleeding patients overnight.